This conference will now be recorded.
Okay, and just so you know what was you just heard, um, this video conference is recorded each month for others who were unable to make it, so they can join us after the fact, I guess. But it's good to have everybody here. Let me remind everybody that we are not doctors; we are just fellow patients, and we may have some opinions, but that's not to be interpreted as medical advice. So we care for each other, and when questions come up and topics so forth, we will give you our opinion, but we also recommend that you go to your doctor as your primary source of information, uh, unless Nancy Capra says something otherwise. Nancy is married to a doctor, so I can pick on her a little bit.
Insider trading.
Yeah. Okay. Well, it's good to see everybody here. And normally if I don't have my groups mixed up, we normally go around the group and ask each person if they have something they would like to share tonight, and then based on that response, then we go back and let each person provide with some comments of what's going on, any questions you might have, and so forth. So, going left to right on my screen, Alexa, do you have anything for us tonight? Do you need some time?
I do not, but as always, I love to promote some of the groups we have. We have men speaking freely, women speaking freely. We have the art class, and we have the creative writing group. And I will post all that in the chat and on this recording as well. Thank you, Lynn.
Okay. Well, we certainly would welcome any additional comments you want to make at this time up front before we get going. Anything else you want to add about those other groups?
Well, the art class you do need to register for, but the creative writing group is in this room. It is on the second Thursday at 6 p.m. Eastern, and that you can just drop in. You do not need to register anything. You can just come in like you've come in this room. And what we're going to be writing about is write something about your childhood, a memory or anything like that. And we'll also have prompts during that. And then, as always, men and women speaking freely is drop in as well. No registration required.
Okay. Well, thank you. Um, Leslie, do you have anything that you want to share tonight?
Just a little bit. I've only got about half an hour, but just a little bit.
Okay. Put a check by your name and you'll be number one on the group. Jim
I'm finally number one.
Jim Marshall, anything for the group?
Yes, I've got something from my sister who has multiple myeloma.
Okay. Nancy Capra, anything for the group tonight?
Yes, please.
All right. A word from West Texas. Rick, anything you want to share with us before you bail out tonight?
No, but thank you very much. I will I will vest Alexa in all my words today. But thank you. And it's nice to see everybody, and good to see you.
Well, it's good to have you with us, Rick. Lou, we're all hoping you have some things to share with us tonight.
Yeah, a couple things.
All right. Okay, Barbell?
I have something to share, yes, but not very much either.
Okay, very good. And Linda?
Yes, I do. Yes.
All right, very good, very good. Okay, well, we're going to be going here first to Leslie, but before we do that, I've got down Leslie and Jim and Nancy and Lou and Barbell and Linda to share tonight. Is anybody on short time tonight? Anybody going to have to leave early and you need to get it out of the way? Leslie certainly is going to be on number one, but anybody else need to be up front as well?
Well, I have a question, Lynn. what
Go
about
ahead.
you? Did you need any time for yourself tonight?
I probably will talk too much as it is anyway.
I love when you talk too much.
But you're very welcome. And now Miss Michelle may need some time too, right before I leave.
We'll say welcome to Michelle, and she's got company at her house tonight, so that means they probably had sirloin steaks. And
You had sirloin tonight, Lynn?
no, I had a frozen dinner.
Oh, Shirley probably didn't like that.
Well, that's what I made, sweet and sour chicken, and it's pretty cheap at the store, and we split one of them between the two of us. And I made cookies for us around 4 o'clock this afternoon. So I'm
That
trying to
sounds-
stay on her good side. I can get on her bad side real quick, you know how we husbands are.
A self-identifying husband.
And I know I'm on her bad side when she says, "What is wrong with you?" Okay, enough. Like I said, enough from me.
This is my sister, Gail.
Hi, Gail.
Visiting. Hi, everyone.
Hi.
Good to have you with us, Gail. Is it Gayle?
Gail.
Okay, that's the way I wrote it on the paper.
So
Okay.
You knew. Hi,
Well, I was
everyone. I'm
guessing.
sorry. I had problems getting on for some reason tonight. It wasn't going to take my my audio, so I went back out and came back in. But anyway, I'm here now.
Well, you're in living color now. It's good to have you with us, Michelle. And I'm gonna assume that you're gonna share with us tonight too.
Yes,
Maybe
I had
some
an appointment earlier last month.
gonna share some hot tea with us, maybe.
Yes, we don't have goodies like you do, Lynn.
Gail, are you having hot tea as well?
I am mint.
Oh. Okay.
Well, it's good to see everyone. Alexa, your hair looks great.
Thank you.
And I'm happy to see Leslie, and I see Nancy. I feel like Miss Jean, Linda, Lou. I can't. You're not in the hospital. Is this good?
Not yet.
Hi, Barbell.
Well,
Hi.
well, we told Leslie that we'd let her go ahead and go first. I think she's going to have to leave early, so we're going to start with Leslie and let her get her comments in.
Okay.
Hi. So, first of all, I want to make everybody jealous and tell you I had pork loin with sauerkraut and apples and a little brown sugar on top for dinner. It wasn't a frozen dinner, though. Sorry, Lou. I mean, Lynn.
Did you make it from scratch?
Yes. Well, I didn't grow the pig, but I did the rest of it.
Actually, it
somebody
sounds
else
very
do that pig thing. So I just wanted to let y'all know I'm having a procedure called a mild procedure on Friday. I'm a little apprehensive, but it's supposed to be an easy thing. It's a back, minimally invasive lumbar depression, I think is and they go in and they open up just a little spot and they scrape out something. I don't know. It's supposed to relieve the back issues that I'm having, my hips and my back. So I'm kind of on the fence about it. But the constant pain that I have every single day of my life is getting to the point where it's, they got to do something or I'm going to quit.
Actually, my aunt, my uncle had that procedure, and it wasn't too bad. So I'm trying to think when he had it, but He was getting epidurals and some stuff like that. And as far as I know, the recovery wasn't bad at all. The procedure and the recovery wasn't bad at all. So I don't know if that helped.
Yeah, that's what those are all the things they gave me up until this point. And they said once they saw that the epidural would work, but it didn't work very long, this was the next step. So then I got to go see somebody about my knees because they're really bad. Everything is pain. And it seems that when they stop the Calquence for a little while, when I have different things going on, the pain eases so much. So if they can't help me with the pain, then it's going to have to be deciding that I don't want to do treatment anymore.
Well, Leslie, I'd love to share that I have seen a world of difference between ibrutinib, Imbruvica, and Calquence. I had a ton of side effects on ibrutinib. And I just tell you this because maybe for you it would be the opposite, or maybe zanubrutinib for you. And it's interesting, they are all the same class as you know, but there are differences because there are some that are different generations of it. And I had to go off of ibrutinib because of all the side effects for me. Yet, knock on, I think this is real wood. I don't know anymore, right? Knock on maybe wood. It has not been like that.
Right.
So maybe a different. Has anyone suggested that for you, or maybe cut down on the dosage?
No, I remember I'm the one that doesn't get a lot out of my doctor.
Oh, I forgot. I'm sorry.
Yeah, no, it's okay. We will be most likely July, August of next year moving out of state. So then trying to find a new doctor to where we're moving to is going to be the next issue that I have to deal with. And so I'm hoping that if I get in to see a different doctor and maybe keep MD Anderson as I don't know how that works out. You know, they'll tell them what they're doing, and then the doctor where I'm at will proceed with that. And we'll go from there. Or, you know, we just lost somebody on the first. I opened up the Facebook, and somebody on an MCL group had passed that morning at 4:35. They had gone in for CAR T cell, and it was the procedures before they had that done, and he didn't make it through.
Oh,
And
that's
so
hard to see.
It's hit me very, very hard, and because it kind of brings your disease into perspective, because you know it's all these things. Oh, there's CAR T, there's this or this or this, but you got to be making it through that stuff for it to help you. And so that really kind of gave me a slap in the face and said, you know, just because it's all out there doesn't mean that it's going to work every time. And that's pretty scary.
It is when someone we know with what we have passes, like when, for a lot of us here, when Tom Henry passed, I don't know if you knew him, Leslie. He had CLL, but he was a pharmacist, and we all knew him.
Right.
He's a CLL pharmacist, yeah, and that was really hard for a lot of us during COVID. And then other people when we know, they have what we have. I'm so sorry to hear that, and especially that your doctor is that's so unacceptable.
Yeah, we've had those conversations.
Yes,
Michelle. So yeah, I'm not really sure if it's per se him as it is the guards that are around him to get to him. You know, you send information to them and you don't get information back. Your team will get back to you, and then it's days before they get back to you. So there's some issues that I'm having with that, and I'm not really sure. I tried to resolve it and they weren't going for it. So it is what it is, and
no,
I just keep fighting and proving them that, you know, no matter what they do, I'm coming back.
Not going. Leslie, where do you know where you're moving to yet?
It'll be Idaho.
Oh,
So we will probably be going to Salt Lake City.
Oh, I know some doctors there.
Cancer treatment.
Well, I know some doctors in Provo.
Right.
Is that where Brigham Young is? I actually know some CLL doc. Oh, sorry.
Yeah, that's that area right there.
Well,
yeah.
Yeah.
So if that's closer, well, wait a minute. But that's not.
Provo is right next to Salt Lake City. It's
Okay.
like it's
Well-
like one from Dallas to Fort Worth. It's right there.
You've also got Portland too, in Washington area.
Yeah. I'm not sure that I want to go into Washington. We love Washington. It was our original home, but everything there is so expensive and so crazy that that's why we're going to Idaho instead of Washington, back to Washington.
How
But
far
that's a
would
whole different
Mayo
thing.
Clinic? How far would Mayo Clinic be?
Where's that? Rochester?
Yeah, I believe right.
Oh,
I think
that's
so.
It's a long way.
yeah, that's a
Oh.
long way.
Okay.
True. We're in a few places now.
That'd be like going from Texas to Wyoming.
Yeah.
It's a ways.
MD Anderson has some different sites in the U.S. now.
Yeah,
Or at
I
least
would look
MD.
into that too.
But if Provo isn't far, we can connect you with someone at Brigham Young. So anyway, but that's this year, this July or next?
Next, when my husband retires, he turns 65 in July of next year.
Young man.
Yeah.
Well, who knows? Retirement age could be different by then. It could end up being 80.
No, because we're not going to pay the king anymore. We're going to have fun now.
Good for you. Well,
Yeah.
That's something we can work on so that by then, maybe if there's a long waiting time,
Yeah.
that you would be in.
Right.
So let's talk about that offline, about seeing how long that takes. Okay.
Yeah. I know that a couple people have said that when they told their doctor they were moving to another doctor, their oncologist said, well, you're done. I'm not giving you your medicine anymore. So that worries me. Yeah, Lou, that I couldn't believe they did that to the person, but why would they do that? But yeah.
That's crazy.
But anyways, my stories are done. Thank you for listening.
Of course.
Well,
When did you say your mild procedure?
That's next Friday,
Okay.
a week from tomorrow.
I'll be thinking of you.
Thank you.
As I'm sure everyone here will be.
Thank you.
Is that at MD Anderson?
Yes.
Is that with your doctor?
No, it's with Pain Clinic.
Oh.
Yeah.
If it was, you'd have a captive audience.
Yeah.
Okay. Well, let's go to Jim. Jim's you're number 2 on our list. Thank you, Leslie.
Thank you.
Okay, update from my sister in Tulsa, multiple myeloma that got up through the spinal cord into the brain. And she had the surgery, but then I guess they did not get it all. So she's been enduring targeted radiation treatments, and I think she's done now. I forget how many she had. I think about 10 of them. So although she does have it, I believe a lesion in her breast, a lesion on the liver, and a lesion which is a lump on her back, but they are not too concerned with those right now. So that was the last I heard out of her. So she is hanging in there, though. Amazing. That's it.
Okay.
It's amazing.
Well, certainly I would, to me, the fact that they're focused on the brain first, that doesn't surprise me. But I guess the other areas are of secondary importance. Lou has stepped away. She's another multiple myeloma patient, and I thought maybe she might have something to add in there. Okay, Nancy, in the north side of Abilene.
Just north from you. We're still on the south side. So, you know, Jim, when you talk about your sister, it just really kind of touches my heart because, you know, I am a patient, but I'm also a caregiver as well. And that my husband is a prostate cancer survivor who just recently had to have everything reevaluated because his urologist thinks that the cancer may be back. And, you know, it's kind of like what Leslie was saying, just about how we get affected by just circumstances and things around us, like seeing somebody's passed away and how that just changes your perspective. And I've been kind of, I think, living in a bit of a pink cloud is what we call it in the 12-step program, where, you know, my remission was just, you know, driving my you know, my life, you know, I don't know what I was thinking, but life very quickly comes back and sort of shows me, you know, I get a choice on how I go forward. And so for me, the things that I'm trying very strongly to not pick up and worry about, because they all have that potential for it, is I went into SVT today and had to have sort of a well, I didn't have a sort of, I had a cardiologist appointment that I had not put on my calendar for today, and then was put on a beta blocker. And
yes.
Okay, thank you,
I
Jim.
know what those are.
Well, good. I'd love to hear more, because, you know, it's like all of a sudden it's a new piece. Now I have this whole, like, I have sort of a plan. You know, I have supplements I take. I take valcyclovir and estradiol, and that's all I've taken. You know, that's all I'm taking right now. And now I've got a beta blocker, and so now it's like, okay, we've got this. Now it's more to know. And I have a cardiologist now. And next week I'll have another. I had an EKG today, and I'll have a echo next week, and I'll have an appointment with the cardiologist. And so I have a whole new group of people that I'm going to get to know. And on top of that, I've been dealing a bit with insurance, because I turned 65 this month at the end of the month. And, you know, I've been paying attention in these calls, and I've been listening to people talk about Medicare. And so I got on and I got, you know, all my stuff in back in February, and I still don't have my number. And so I had to extend my private insurance for this month, which I know these are just, it's kind of like one little thing after another. It's all the little bowling pins falling down. So my private insurance is Texas Blue Cross Blue Shield, which is great insurance, unless you go to UT Southwestern for your care, which I do. So now they're in sort of the same discussion that Lynn had to go through with his insurance, and that whether or not they're going to take it and whether or not they're going to continue to take it. So it's all a little bit stressful here. And I think what I'm asking is if you guys will just kind of think about the positive words, you know, and speak them tonight to me, so that I don't pick up all this, because I'll need something about 2 a.m. to be reminded of. So if you could each give me one of those words for my late night.
Okay, I'll tell you on the news yesterday, it said that they were in continuing negotiations, and I can't imagine that they will not come to some kind of agreement because UT Southwestern, in fact, someone told me today, I was there, and they said that their insurance is administered by Blue Cross Blue Shield. So, you know, they're not funded from Blue Cross Blue Shield insurance company, but they administer their policy. So I would think that they would come to some kind of agreement at some time.
I have my appointments at UT Southwestern are not till May. So I feel like I have a little bit of a buffer.
I asked somebody today because where I went was not busy at all. And I said, is this because of the April 1st of Blue Cross Blue Shield? So I don't know, you know, they didn't know that. So it was not busy.
Nancy, so do you have insurance right now through your husband's work?
No, he's 65. He's a year older than me, actually. So he's already on Medicare and the supplement. And so, yeah, we just have private.
I wasn't sure. I mean, I'm lucky in that I get to be under my husband's.
Yes. I feel very lucky in that I have very good insurance, and my year of treatment with the obinutuzumab and venetoclax certainly balanced the amount that I had paid to my private insurance for what they paid for my treatment. So I feel very blessed, and I don't have and gratefully it's not financially going to put us into a whirlwind. Now the tariffs might do it, but my insurance isn't going to do it.
So even though you turned 65, you said this month, it doesn't go into effect the first of the month. This month, I mean,
until I get my number, they can't file it.
And so that is true that there's a long wait.
It's a Social Security office issue.
Yep. There's no one there to answer the phone and help you. Sorry.
Social Security. You have to go to the place.
Yes.
Yeah, you have to go in person now, right?
But they've closed
Yeah.
the office.
Yeah. I did
That's my plan tomorrow, is to go to the in person to the office here and just walk in and see if they can, because I've already I did talk to someone on the phone through the website, and she basically just said, well, it should, it'll take 60 days. Well, we're past that now. But at the time when I talked to her, I said, well, the website says 30, and I thought I was way ahead and she said, oh no, I wish they'd take that down and and I was like, well, I'm going to tell all my friends to go for 90 days.
Yes.
Wow.
Nancy, I got a question for you on the heart issues, and how come they put you onto that drug, and which drug are you on offhand?
So I was having tachycardia, and I was at 141 this morning, which my husband, his normal is like in the 50s, and he does, like, he's pretty proud of that. But my normal is usually in like the 70s, but really more like the 80s, if I'm being honest. And so 80s is normal. They put me on, so they did the beta so that thought, instead of me going and getting the IV there's a stuff, they thought maybe the beta blocker would convert it, which it has. I'm back in the 80s. And the drug they put me on was metoprolol.
Oh, tartrate.
Metoprolol.
Metropolo tartrate.
Correct.
Yeah.
I also take that for the AFib, because out of the triple bypass, I had that for like 5.5 days. It was between 100 and 163 for 5.5 days until it was then anyway under control. But it works fine. It isn't a problem. Did they
Are
tell
you still
you?
on it?
Yes, I am forever. Did they tell you to take it with food?
No, and the jar doesn't say that either. Does that help?
Well, it doesn't help. It's supposed to be with food. Let me get mine out. I have it right here. And in fact, yes, it says take 1 tablet by mouth daily with a meal.
Okay.
Preferably, I believe, in the dinner meal. Okay, in the dinner one.
So
I
I'm
would.
on, one
Oh,
tablet twice a day, 25
each
milligrams. Yes,
each 25 each. So that would be
yes,
breakfast and dinner.
dinner. Yeah. Good
Yep.
to know. Thank you. Yeah, that's good.
Or supper at my house. At least the way I was raised. Well, Nancy, sounds like you've got a lot of excitement and yeah, some words of encouragement for 2 o'clock in the morning. Certainly a prayer, and remembering our blessings of that we have.
Yes.
But also remember that I may be tossing and turning with you, and others here may toss and turn with you as well.
So is this you wake up worrying in the middle of the night, or you can't fall asleep, Nancy?
I wake up and then I, lay, and there's just sort of this magic that occurs. And sometimes the magic is like I go back to sleep. And sometimes the magic is like all of a sudden my calendar pops open and I think about this or that, or my daughter, something she said, I have to think about, but late yesterday, and it was kind of funny because last night there was sort of a period where I was kind of worrying about this Social Security and Medicare, and I thought, why am I worrying about this? It's gonna work out. It's gonna work. I mean, that's my experience in this whole life, is that things have worked out.
It will.
Yeah.
I have the disease and I do that. Yeah, that's I don't know. I don't mean to be sexist, but gentlemen, do you wake up in the middle of the night worrying? You do, Lynn?
I do.
You do,
Well,
Jett?
it isn't worrying. It's thinking about all of the things that I need to get done or the things that I should do, and then trying to just calm down. But, oh, Nancy, you do not have to worry about hubby, because if he has issues, especially on the prostate, he can join our high risk group and they will educate him like crazy, because we already have 5 or 6 MDs in the group who are stage 4
Yeah,
recurrent.
that
And
that
there's a
would be
wealth
really good.
of,
He would be a great. I mean, he's really good. I
sure.
just need the information. Like if Alexa, if you can put it in the
Oh,
chat.
Alexa can do it. Also, I take it he is not a veteran, right?
No,
Oh, okay, shucks.
our
I'm gonna
son is
try to-
better.
Oh,
I'm going to try to get my brother to join y'all. He is a veteran.
oh yes, he should join my Mary group that meets 2 times a month on the first and third Tuesdays, 8 o'clock.
Yeah.
And we assist veterans understanding the VA because I have more intimate knowledge of how the VA works and where it maybe doesn't work so well. I understand the VA. So just a plug there.
That's a great thing. That's such a blessing to people because that is a real challenge to navigate.
One
I
more
take
word
care
for
of
you
them.
about 2 o'clock waking up. Barbell's already up, and it's 2 o'clock in Germany right now.
I was thinking about Barbell. I thought she could just speak right now and it'd be right.
She even put her lipstick on for us. That's how
Yes,
much she does.
definitely.
Tonight.
I think Leslie's going. I saw a message flash up. You leaving us, Leslie?
Yeah, I gotta
You,
go. I'm
Okay.
sorry.
all right. Good,
Hi,
good to have you
Leslie.
with
Good
us.
luck on
Left
your
y'all a
procedure.
message.
All right.
Well,
Well, before we go to Lou, is there anything else, Nancy, or anybody else have anything for Nancy? Well, Lou, we've been waiting to hear about this CAR-T that was going to kick off last month, then again maybe this month, and I've got a feeling it's still been postponed.
It's a go.
Oh,
good.
okay.
Yeah.
Light the fuse.
I got word 2 days ago, I think it was. They met the data collection, separate independent data collection group that consults, with the drug company. It's Bristol Myers Squibb, who is conducting this clinical trial. But it is on, and they are accepting new patients, and it is starting to roll. I've talked to the scheduler and the nurse for the clinical trial. So I've got tomorrow at 7:45, I have labs. And then at 8:15, I meet with the doctor who's running the clinical trial. And then after that, I meet with someone. All I know is her name. I have no idea what she's for, but I've done this before, so I know that, they have paperwork that you have to sign again. I have signed, I think, 3 different copies of this particular clinical trial paperwork, consent forms. And the new one is supposed to have those extra things. I think it was side effects that was holding up the clinical trials. So anyway, I expect that wording to be in this new consent form that I'll have a chance to look at. It's a little concerning what I heard today. I was in a coaches meeting, health tree coaches meeting, and Sally was there. And one of the persons who's a coach, he's also starting the quintessential trial, clinical trial. And he read what his doctor told him was going to be added to the paperwork. So a little daunting. I've signed paperwork before for clinical trials. This is my 5th one. And I know that they say, could cause this, could cause that. This one, I think, will be saying something about 10% of the patients develop neurotoxicities that are permanent.
Ooh.
So that, where it would involve help with walking, it could involve speech, issues with speech. I will find out more tomorrow. I've not signed any consent forms before in the past for the other 2 CAR-Ts that I've done that talked about the permanence of those neurotoxicities and spelling out what kind of needs you might have. That is a little daunting. So David and I, my husband and I are really going to be questioning the doctor tomorrow. So far she has, with her patients that she's got in the trial already, they have not had any issues. But 10% is a little higher than I expected. and the fact that they were spelling out particular, permanent possibles. That was a little more. I know that I've signed paperwork before, that'll even talk about death. It'll say that's possible, so I have, I'm familiar with that. I don't know why this wording, the way they have it, just seems to be a little more concerning than I thought, and that's why the hold. But anyway, I have a bone marrow biopsy. Line is put in before I can receive my CAR T cells. Lymphodepleting comes in between. So I'm guessing about the 21st, I'll be in the hospital. There's things that have to happen, within a certain period of time. Lymphodepletion that chemo takes 3 days. And then you have to have 2 days of rest. And then you go to the hospital for your CAR T cells. So it's all, very systematic, and we'll talk to the doctor tomorrow. So we'll find out more.
Lou, what phase is this trial? What phase? The trial one?
It's a two.
And how many people do you know? And obviously 10%.
I think she's talked about 250, but I'm not positive. It's in several of the major, university hospitals across the country. So, it's
10% had neurotoxicities that were permanent.
Permanent, yeah.
Any deaths?
Anyway, we'll find out. David and I know David will. He's a big question. He questions and then follows up with addition. He'd be a good news reporter. He follows up with a lot.
I ask a lot of questions. Sorry.
Yeah.
If you don't want to answer them, you can tell me. I do have one other question. Can you wait for phase 3 of this trial or not? Or do you need to go to treatment now?
My numbers are increasing. Kappa numbers are what they're looking at. I'm at 12.22, I think it is. And every 2 weeks when I have labs, it goes up at least, 1.5 or 2 points. So I'm not going to be able to wait for phase 3. So if I don't, go forward with this, I'll have to do another type of treatment, which I've been through so many. I don't know what is possible after, if this would not follow through. There was one other thing I wanted to say. I did not, Jim, I didn't hear the last part of what happened with your sister who has multiple myeloma. Was there a question that you had?
Yeah, you were out of the room, Lou. So yeah.
Right, but I had my
a question. No, actually, it proceeded to the brain. Okay, and they did
I heard
surgery.
that.
Happened to get it out, but it's also they believe on her liver, a part in the lung, and in the breast. In a breast, and then a lump on her back.
Oh, goodness.
And so I guess they are going to treat those eventually or not. I don't know.
The targeted radiation, possibly?
Yeah, well, they did it on the brain first. And I don't know if they are going to target those other ones, because I don't know if they happen to get it all within the brain, because there are days that she is quite good, other days she will forget things, and so I'm not quite sure how long she will last. But she's tough.
That's sad.
I don't know.
Boy, you have to be. Whether it's CLL, myeloma or whatever blood cancer, this isn't for the weak. This is a tough battle. And, if you're in remission, you are always looking over your back, wondering, when is this going to fail? I think in the almost 12 years now, it'll be 12 years in May since I was diagnosed. I think though, I was stuck after the meeting last month. I don't know at the meeting if I mentioned about feeling stuck, frozen. And it was because, everything was on hold. My life was, like on hold because of treatments, wondering what was going to happen. But I don't know what it was that triggered me to think about, I can't do that. I cannot put my life on hold for things I don't control. I can't control when the clinical trial starts up. I can't control what my labs are each time. But letting go and just saying, I told David, I said, we're just going to make our plans. We're going to plan on going to the coaches summit in June and just make plans and not freeze, not have our life frozen, waiting for things we have no control over, that I have nothing over. My word has always, and this goes to Nancy, my word has always been hope. If there is anything that helps me is to think about possibilities, and the hope that's there. And the second thing I wanted to mention was I'm putting a book together. Um, I have continuously since 2013 kept a Caring Bridge journal. And I don't know if all of you are familiar with Caring Bridge, and it's like a journal that you can post in and share with your friends and family and things like that. Anyway, I've kept it since 2013, right after my diagnosis, because I heard about it and I thought, I got to keep this, I got to document this. And I'm glad I did, because it is my story. It's my story of hope. And the title of my book, I have been thinking about, and I have to have hope in it. So it's my journey of hope, myeloma story. So anyway, I've talked to another blood cancer. Well, actually, he was lung cancer, who I think I told you all about being in the Wall of Hope, one of the featured cancer survivors in the Wall of Hope at the University of Kansas Cancer Center. On the wall, I think I talked to you guys about that. Well, the person who gave the money for that wall to KU, he wrote a book. And that night that they had the dedication service for the wall, he gave me a book, a signed book, and wrote in it. And I didn't get around to reading it right away. And then that period of time that I was stuck, earlier in the month, I was looking at it, and I thought, you know what? I need to get this into a book form, my journey. And Paul did the same, but he's a lawyer, and he approached it, differently. He had lots of sightings for bibliography. I mean, his was a book. Mine is going to be a journal. And I will preface it with a couple of chapters at the beginning, introductory and background. And then David, my husband, I asked him to write a chapter at the end. So that's what we're working on. And each date in my journal, each entry will be a chapter. And I've been working on transposing that information into a Word document. And I've gotten up to chapter 80. So, and we're talking 1 and 1.5 pagers, for a chapter, because it's a journal entry, but I'm also numbering it as a chapter so that it's easier for the readers, to find their place in the book. So anyway, that's what I've been working on. And my word is hope.
Lou, I have a title for you. 31 bone marrow biopsies and hoping for more.
I might turn off a few of the people in our myeloma support group.
Yeah, you might. Or
I
it
told
could be 5 clinical trials and hoping more, or 3 CAR Ts and hoping for more. Is this your third CAR T or your fourth one coming up?
this is my
Number 3.
third CAR T, 5th
Okay.
clinical trial.
Yeah.
But I was talking to the radiology department, a nurse there today, because of my bone marrow biopsy scheduled for the 10th. And she was saying, you need to do this and you need to do that and all this. And I said, this is number 31 for me. This is my 31st. And she said, really? She said, you win the prize. She said, I have not talked to anyone who's had 31. So that's really, that's really not a prize I wanted to win. So anyway, that's all I had to share. But
Well, we look forward to reading the book, and you might put the title of the book that Paul wrote in the chat, and we'll see if we can find it.
It's incredible. It's really good. It's about lung cancer. He also had prostate cancer as a secondary cancer. So he dealt with 2 things at the time. And he is a great researcher and gives lots of information. He interviewed, I think he said, I don't know, 30 or 40 patients, cancer patients. And so he shares some parts through the book about the stories. But he is really a very good writer. And I told Paul, I said, I have to be honest. We met with him last week, David and I, to talk about his book writing journey. And he gave us some suggestions for a publisher and things. But he's a lawyer. He could go with a more expensive option than we are able to, but he did give us one that he recommended. And Simon, I think it's Simon and Schuster's Archway is their self-publishing, and they have a plan that is for us doable. So anyway, that'll be fun. But I did tell Paul, I said, you know what, Paul? We have I'm involved in so many support groups, but I think anyone who has cancer could learn from your book, because there's so much about how to live, how to get through it. And his journey is so interesting. And he was stage 4 lung cancer, and that's tough.
Yeah.
So anyway, he said there are not many books, I guess, out there for people who survive lung cancer, because he said they usually die. They don't make it.
Yeah.
Is what he said. And so he said, I felt I needed to do this. So I will share that. Should I do it with Lexa as far as the title in his name?
Okay.
If people are interested.
Okay. Well, very good. Well, we've been waiting to hear what's going on in Germany, where it might be 3 o'clock in the morning. I'm not sure, but
it is almost.
It's 3. Oh my goodness. Well, I'm gonna get up and make some hot tea. I'm jealous of Gail and Michelle drinking hot tea. Is it herbal tea, or is it does it have some caffeine in it? Nod your head if
It's
it's.
or decaffeinated.
Oh, okay.
Decaffeinated. It is not with caffeine, nor is it with anything it's herbal like spiked. So yes, it's herbal, but it's
It's herbal.
very watery. I think it needed another
Okay.
tea bag.
Okay. Well,
Which one do you
Barbell, I'm gonna turn off my camera and my microphone, but I got my wireless earphones. So take it away, and I'll be back by the time I get the hot tea made.
Okay. So, well, I had my blood work done, and well, it looks good, except for the protein. Still, that's not so good yet. I have another appointment on Monday for another checkup, but other than that, I'm feeling all right. Let's say, with 2 blood cancers, I guess I'm doing fairly well. I'm at home most of the time. Actually, I can't get out because I can't walk steps. I live on the 2nd floor, and I cannot walk down the steps. And well, the walking is still a little bit of an issue, but I'm working on it. But other than that, I'm doing okay. I'm quite busy. I had a Zoom meeting today, so another one. So I'm quite active, I'm doing all kinds of things.
You look good
And
today.
yeah, but otherwise, I'm not a person who sits at home and watches TV or something like this, Well, some people, when they spend their own old age, they do crazy things, Some run into the halls to work on the one-armed bandits, and spend their money. And others sit at home and watch TV, and I do none of this.
Barbell, maybe you should get a slide to go down the stairs.
Then how do you get up?
Yeah, it's the 2nd floor. It's a lot of stairs to go, and well, my feet are still not like they should. It's kind of risky.
Are there
So
any?
I don't want to take a chance, because if I fall down there, I'll have a problem.
Can you get a 1st floor unit? Are there any?
Well, actually, I put in for another apartment, but to get one on the ground floor is very, very difficult. And I have people who help me. I have many, I can address, bring me up the parcels or the mail or so, and I have a lot of help, different people I can call or who help me. I have a woman across the hall. She is from Afghanistan. She's a refugee, and she helps me a lot, because when I got home from the clinic, I couldn't move. I couldn't get, I had enough strength, but my foot was always disappearing, and I cannot walk on one foot. So it always, that was difficult, but in the meantime, it's better.
Well,
And I can walk now without a stick, but it's just in the apartment, and I have a very small apartment. That means I can always hold on to things, to be sure that I don't fall, because I don't want to fall again, because I've been falling quite a bit, but I have good bones. I never broke anything. So
that part's good, but you don't want to either, right? You don't want to tempt fate.
no, I never broke anything. I never broke an arm or a leg or and I don't have any other health issues. That is good. But I mean, the cancer is plenty. It's my 4th treatment now, and it's still ongoing, and I hope it holds out, and I have no drug rejections or anything. But since it's a very new drug, you don't know what will happen, in the future. So I'll have to see.
We were talking about BTK inhibitors in our last meeting, and you were talking about that the EU has not approved pirtobrutinib, but I saw that it is coming up for approval.
Yeah, that will be coming up, but it's still not clear with the, I sent you an essay on your messenger account, about these special mutations with xanoprotein, and well, that is not clear yet. So I have to avoid these mutations. I don't like those mutations at all, because I think we have enough problems with our blood. We don't need additional mutations.
That's very true, and some you don't know until these drugs are out a little while.
Yeah, the problem is that it happens at different times, with every patient. But well, I mean, you have a kind of a safety time, though. I know with venetoclax you can take it like 19 months at least. There are various studies, 19 months, some say 2 years. But
Some
if you
say
want to be
12
on
months.
the safe side, you have to stop earlier or reduce the dose. But for some reason they don't look into that. If you can take it longer if you reduce the dose, and what are the conditions for reducing the dose? It's not clear.
Nancy,
And now with the new IE, where they can find out how fast your cancer cells divide, you also can detect how aggressive your disease is, and accordingly you can also use the medication then, because if it's more aggressive you probably need a higher dose. But they should do more research.
I know that they had, I don't know if the results had come out yet. I know they were looking at some things at lower doses, because obviously some patients do okay on lower doses, case by case. But you're right about that. But Nancy, you were on venetoclax. Was it for 12 months?
Yes, I did the I think what's considered the standard first line treatment, which was 400 milligrams of venetoclax for 12 months. And I didn't have any trouble, but definitely other people that I had, during the journey, were on the same treatment who did have side effects. Their doctors bumped them down. And then there were some also that were extended past a year. So
Right.
they definitely, I think they tweak it. And I think the doctors just are making those decisions.
Yeah, but they don't know themselves. That is the problem. And the studies don't give any hints, how to do it. And well, side effects can come from many things. It's not necessarily from the drug or from the treatment. It could be from another drug that you're taking, or maybe the way you live. You drink too much coffee, for example, you have a heart problem.
You get a beta blocker. Yeah. No, but
they gave me a beta blocker once, but I couldn't tolerate it, so I threw it away.
But I feel like our treatments are very state of the art, but it's very new. Like a lot of, there just isn't years and years and years to look back on, because they've had so many breakthroughs. And so I guess for me personally, it was like just saying, I'm going to trust the science here, or what they know. And then my faith, I have to connect it to my faith, because for me, God's in control. And so
yeah, definitely.
That's where I have to because venetoclax and obinutuzumab are new. I mean, 5 years is not a long time.
No,
No,
So,
it's not.
I first took it in 2020.
What I do is I inform myself in different sources. I read articles, I talk to people like you now, or I talk to doctors. I'm on Zoom meetings, so I get really a lot of information, and I put it together like a puzzle. And then I ask myself, about my intuition. My intuition is pretty good because I only have the blood cancers. And when I'm convinced that it's the right thing to do, then I'll do it, even if it's difficult. But I have to be convinced. I have to have this feeling, now everything fits together.
Barbell, I love your spirit. Your attitude and your spirit are so encouraging to me. And I am so grateful that you do so much research, because I tend to be much lazier, and I like to just sort of sidle up to someone like you and get a lot of information. And you always have a lot of information. I'm so blessed by that.
I collected it before, and that's when I started, having this platform and this all where I publish it, because I thought, I did so much work. Maybe someone else will benefit from it. That's how it actually started.
Well, Barbell, we appreciate you being with us tonight. And my goodness, I wonder if there is a group that meets at 2 a.m. in the morning that Nancy could join to.
We don't have any Zoom meeting groups in Germany. That's really bad. There's really nothing.
Well, it is definitely a interesting experience that we've had with our disease of the friends we've made. Goodness, I mean, even Nancy, that I might not have ever met Nancy, even though we're in the same community, same area, 140,000 people or so, but we also happen to go to the same church, or maybe not.
We never knew each other from that either. But, and I just want to say, kind of in regards to all that too, Lou, I so appreciate that you were so willing to talk to my daughter-in-law's family. And he actually passed away in January. It went so fast, and he had, I think, complicating issues, and so surprising. But what was so sweet was that they had access to you. I don't think they ever did anything, because it really happened so quickly after we talked. But these groups are invaluable. And the fact that you gave me your email, your phone number, and I was able to pass all that on to them, that's really a gift. I just think, and knowing now that Jim's on a beta blocker, the exact same one, and just like tonight, knowing that I should take it with food, simple thing, but if I hadn't been on tonight, I wouldn't have heard that.
It means a lot when you find other people that are experiencing the same sort of thing that you are. No longer you feel like that you're in this alone. It means a lot. And that brings us.
I mean, you can tell other people, but they won't understand.
Yeah.
And they always say, "You look good. You don't look sick."
But when you're together with other blood cancer people, we understand, and we may use different drugs and different doctors, but we have similar procedures and experiences and side effects and hopes and dreams and disappointments too that come. And Linda, we're anxious to hear what you have to say for us tonight. Now, but Gail's going to talk after you, so Linda, you're up next.
So first of all, I had laryngitis. So from the last meeting, I caught a cold. And as a result of the cold, I had started the Kineret treatments. They had to stop. I've just finished a week and a half ago, I finished my second round of antibiotics, and my blood numbers are still going down. So the doctors today, I saw the pulmonologist on Tuesday, and the pulmonologist felt that what was going on, that he didn't want me to go a third round of antibiotics. However, my treating physician that I met with today wants me on another round of antibiotics, because I can't continue treatments until this clears up. So
I've
that's
got the same issue. I had the same issue.
it's just like it's crazy. Then
It is.
then I had mentioned that I was scheduled for the ultrasound. I had an ultrasound of my liver, and I have multiple hepatic cysts, and a couple of them are large. So she sent me to another specialist to have that checked out. And then my collarbone, there's a growth or something going on in my collarbone. So I'm a little concerned because with the citrus syndrome and with the MGUS, it does lead to the Western disease, which is actually the cancer of the bone. So I'm a little concerned, with the results today. Oh, and then I saw the ophthalmologist, and because of one of the treatments I was on last fall, the ophthalmologist had to be involved in the process. So when I went for my checkup, my 6-month checkup, she determined that I needed to have cataract surgery, which was a shock because when I was in 6 months ago, before I started this drug, this other medication, I was like 2 to 3 years out for cataracts. So when she said you have to have cataract surgery on both eyes, I was just like what in the world? Like it was so shocking. Was she saying that some of it is from the treatment drugs that they used last time that accelerated that, which I had not heard that before until my other doctor today said, "Oh yeah, that's like one of the side effects." And I was looking at her like, "Well, do you think somebody could have told me that that's a problem, as well?" So I'm on weekly labs, which some of you all can relate to that, and then I see the hematologist later on this month. So that's what I have going on. So Nancy, my word for you is that as I was leaving the doctor's office today, I was like, okay, I could be discouraged by all of this that's going on, or I could be encouraged. So it's encouraged. It takes more to be encouraged. It doesn't take a lot to be discouraged, but to be encouraged because at least I have a great medical team that I'm working with, and I can still get up and move around. So regardless of how badly I feel, we're still able to get up and go out and do things. So even being grounded for 2 weeks, the doctors had me isolated in the house. I had to do takeout, order food in, have deliveries. I couldn't be around anybody because I just can't shake this. So this has been a month. We're red and inflamed. So that's kind of what I have going on. But I appreciate being here because, Barbell, to your point, and Nancy, the same thing is that people don't get it. When you start talking about cancer of the blood, they look at you, but you don't look like everything's fine. Yeah. And that's not the case. There's a lot going on inside, internally that people don't see. So that's what I have today.
When your blood work is good, your complexion is good. And my problem was when my kidneys failed, I looked healthy. And the doctor said, well, I wasn't feeling well. And he said, well, you look good.
Right?
When
Yeah,
he did my blood work, he found out my kidneys only worked 5%, but I looked healthy.
right. And say that's just it. Like my numbers keep dropping. My numbers have been dropping. And so every week when we're doing the labs, so I talk to her and then I go in. But with the Kineret, we had just ordered it. We had just started the Kineret. So even though I wasn't excited about the injections, daily injections, definitely not excited about that. But I was just getting started, and they said it takes 2 to 3 months before they can even tell if it's actually going to work. So now so I'm off of that until we can get this viral, whatever it is, cleared up.
Yeah,
Linda, thank you.
my bacteria were in the blood. That was even worse. But they had to go first because other than that, they don't start the treatment. And the anemia was getting worse because the hemoglobin kept going down. I was down to 5 and 4.
Right. Well, say my white blood count, like my counts are low, and plus I have neutropenia as well. So that's like a whole separate thing, all by itself, right? That's so like it's all these things, these different layers, but they all affects the other.
Have they done anything about saying about giving you the infusion was
IBIG.
the IG?
Not yet. I think that's going to be up to the hematologist to make
Yeah,
that.
because that will keep you from getting infections and things.
Yeah, but when your
crazy.
protein is high, you can't have these. That's what they told me.
Oh, really?
Yep. Because I had once, and they said, now we can't give it to you. Your protein is too high, and with she has MGUS, right? She
Yeah.
also has high protein, and they can't give it.
And this is my I started with the scratchy throat March 6th.
Mm-hmm.
March 6th, and I'm still like the first 2 weeks, I had so much congestion. I went through boxes of Kleenexes, just the coughing, the hacking, all of that. And that was on the Z pack the first week. And so when I went back and I was like, yeah, nothing's working. She was like, okay, let's on another round of antibiotics. So then I was on doxycycline. And so now they have to make a decision about what I'm gonna take next.
So do you, so is what you have right now what is making your blood counts be off potentially?
My blood counts were off anyway.
Right, but has it made it worse?
It's made it worse.
But that will hopefully improve when you're better. Except because your counts are off, it's harder to get better. It's just such a catch-22.
Exactly. Yeah, because my counts have always been low. And so that's what the Kineret, that was the goal. That's the interleukin 1, I think it is. So that was the goal, like that, to help get those numbers up. But just picking up a cold like this has knocked everything down even lower than what my norm is low. It's knocked it down even lower.
And as far as what you were saying on the counts in a blood cancer, and that is something that can happen with MGUS, but not MGUS the same as multiple, or would it become very similar to multiple myeloma MGUS?
I'm not sure of that. I know like having the MGUS, but also have the Sears syndrome does trigger it does trigger that. And so the fact now that with the cyst on the liver, that was like a blow. That was like unexpected. And then the concern about the collarbone. That again, that was like an unexpected. And she was telling me today, she says, no, we got to get them checked. So I'll see a specialist for the liver and they'll make the decision because one of the cysts was a pretty large. And so she had concern about that. Plus I have a lot of pain there. The bone, the collarbone. My concern with that is that one of the cases I was reading, somebody else had the same thing, an issue with the collarbone, and that's where they found that the Westerner had already started in the collarbone area. So that for me, that's kind of like a little bit of a concern that I may be further along than what I thought.
Linda, on a completely different note, my cataract surgery was my very favorite surgery ever. I loved getting new lenses. I was so excited about my cataract surgery, and I did them one eye, and then 2 weeks later did the other eye. And I prayed before I got my lenses that they were being crafted in heaven. I was like, okay, just go way out in the skinny branches. So I want lenses from heaven. And in my surgery, because it was a propofol type situation, I actually saw Jesus in my surgery, anointing my ophthalmologist, and shared that with him. And then after the second one, I just loved how I could see after that. It was the best thing I've ever done. I was so excited. Of course, I've worn glasses since I was in first grade, and I've never not had glasses, and it's been so much fun. I've loved it. So I hope that will be encouraging when you get to that place. But you know, like I said, for me, it was the best news ever when they said I could have cataract surgery.
Well, I wish I could say that I was excited. I was just like stunned beyond belief. I was just like, what? Like I just could not believe it. And I've worn glasses since elementary school, but I wear contact lenses. And so for 6 months, I couldn't wear contact lenses because of the other drugs they were treating me with. I couldn't wear my contacts. I had to wear glasses all the time. So now it's like when she said cataract surgery, so a couple of my friends was like, oh, yeah, it'll be great. It's not that bad. You won't have to wear glasses anymore, no contact lenses. And I'm like, no, you don't understand. I got enough going on.
You do. You
So I
do. You sure do.
so I'd rather wear the glasses or the contact lenses, But thank you for that. Nancy, I'll let you know when I get ready to have it so you and I can talk.
Yeah, I'll pray for your lenses.
I'll join in with you on that one. Thank you.
Linda, do you see I know you see a hematologist, oncologist, but what do they specialize in? Do they have one specialty or a few?
It's a few, and Dr. Brownlee specifically with the MGUS. That's one of her areas of expertise is the MGUS and the Citrus syndrome. So she's both.
She is a specialist in I'm sorry, I can barely say it.
Yeah,
Schnitzler.
I know it takes me a while to look the Citrus syndrome and the MGUS.
Didn't you say there were only 1,000 people who have it? What are her other specialties then?
I'm not sure what her other specialties. I know that specifically, and then the other doctors that I'm seeing, they have like the pulmonologist, is for the lungs.
Right.
So first I thought I had the sarcoidosis, and then I have the dermatologist for the rashes or anything like that. I have that as well.
I meant more does she
have a rheumatologist.
Usually an NGUS doctor will also be a myeloma doctor too.
That's what I was going to ask my next question.
Should be, but I would double check. I think a big concern would be that you are having issues in collarbone and myeloma. You can have lesions, in your bone, and that's not uncommon. And if that is in fact myeloma in your collarbone, then you're not MGUS anymore. You're active myeloma.
Right.
So, I would encourage you to have that. You maybe already have talked to your doctor about, is there a way we can verify, what's in the collarbone, because that can change your treatment.
Right. Well, today, and she ordered the test today. So like when I was in today,
Good.
they ordered the test there, and then also for the liver. I think for me, what was a little difficult is that I wasn't expect like the results for the liver. That was shocking to me. That was just like
I have a small node in my liver, but they watch it. It shows up in scans when I have scans for the myeloma.
right.
So I did get referred to the liver specialist at KU,
Right.
but they keep an eye on it. They're not overly concerned, but they're not wanting to mess with it.
Right. See, and that's what we need to find out, because I was saying to her, like, well, how do I have multiple? And that's what showed up in the ultrasound. I was like, well, how do I have multiple? And some of them are large. So that was a concern for me.
One of the things that my doctor said, because I had spots on my breast and on my liver, is you have a blood cancer. So it's going to be all over your body, in some way or form.
Okay.
Linda, and I'm not the multiple myeloma specialist. I just report on it. I mean, I don't have it, so I haven't been through it every day, but you had said something about bone cancer, but multiple myeloma is not
I was concerned about if that was the case with the bone.
And yet she's a multiple myeloma specialist?
The hematologist she's the one that diagnosed the MGUS and the Citrus syndrome. So she's a part of this Myelo Cancer Center.
But
the hematologist.
She said that it could potentially be bone cancer versus.
No, I'm saying I said I was hoping that that's not the case. Like when it show up in the collarbone.
Yeah, you have so much to worry about. Perhaps that's when you shouldn't. But also, as Lou was saying, I mean, multiple myeloma could affect your bones, but it wouldn't be bone cancer.
Okay.
Did I say that correctly, Lou? And you have so many other things right now to worry about. Not that that's not to worry about, but
right.
But often multiple myeloma is one of the signs of that. I believe, Lou, is the issue with the bones. Is that sometimes a clue?
Yes, and a lot of times that's how people are first diagnosed. A lot of times it's in the spine that people will have a lesion, and you know, a collarbone, you know, it could be any of that. So it's in your ribs. I've heard people talk about lesions in growths on their ribs. So myeloma can manifest itself like, you know, earlier you were saying, Judy, that it can manifest itself any place. So I would definitely be interested for you to be sure and check out what's going on with collarbone. And if it truly is myeloma, you're not MGUS anymore. You know, once you have either lesions or your protein in your blood increases or any of that, you know, you've got to think about active treatment.
Right. Well, see,
You know,
and my next went with the hematologist this month.
right,
Part of
right.
the conversation was, do we go from watch and wait to starting chemo? But the other doctor we had started with the Kineret, said that might start to relieve because I've had bone pain for like over a year. It'll be a year, April 9th, actually, that's this whole thing started. So with the Kineret, that was one of the things they were hoping that was going to alleviate some things and balance some things out. But like I said, it was only like just about 2 weeks in before I got this cold. And so now it's nothing. But I see the hematologist on the 24th, and I'll have the
Okay,
test. They already ordered the test for the collarbone and for
good,
the liver. So by the time we meet next
good.
month, I'll have one.
Yes. Well,
They
good.
give you anything for your neutropenia fever or neutropenia?
Say it again. I didn't hear you.
Are they giving you anything for your neutropenia?
Not
Oh,
right now.
really? They're not giving you any boosters for that?
Not right now, because with the Kineret, my understanding is with the Kineret, anything like I guess what's what I'm looking for? Like I know like vaccines or anything like that you can't have with the Kineret.
These
Anything?
aren't vaccines, though.
Okay.
It's
Okay.
not a vaccine. It's a builder of I can't even
White blood cells.
neupogen shots. Is
Yeah, yeah.
Okay.
Neupogen or neulasta.
yeah.
Okay. Okay.
I'm not trying to alarm you, but maybe you should just call your oncologist and see if they would see you or at least talk to you sooner than 2 weeks. Not to alarm you, but it's just you have a lot going on.
Right. I put a call in when I got in today, so I'm talking to someone tomorrow morning.
Oh, good.
We'll do a virtual tomorrow.
That's great. And they may know best also on the course, how long you should be on antibiotics or maybe switch it up. But
Right.
also, as Judy had brought up, I don't know how low your counts are. However, one of those, if they're low and if they're that low, usually one of those are given, the neupogen or the neulasta, which
Okay.
can put into the chat how they're spelled.
Yeah.
Excellent.
Lynn did. Lynn
Yeah,
put it in the chat.
there.
Okay, well, I think next up is Michelle and Gail. Oh my goodness,
Oh,
what a feature we have here. But
you know, we could do like a little song and dance for you, like when we were little, little tap dancing and singing, me and my shadow, but
Gail, I've got a question for you.
okay.
Is Michelle for real, or is the Michelle we see on these video calls? Is that the Michelle that you know?
Yes. I don't know
What
if
a
that's
wonderful, what a wonderful
I don't
sister.
know. It's the same as she is tonight, yes.
How am I?
Or is she just behaving because I'm here?
Yeah, we noticed that she's a lot different tonight with you here.
Oh, really?
No, no. Well, Gail, you've been very patient to in effect, ride along with Michelle tonight.
Well, I know that unfortunately, we don't live that close to each other anymore, and I hear about what she's doing, and I know what she's doing, but I haven't had the opportunity to see it in person. And I think that, and so, This is nice for me to know. So when she's talking about this, I can picture it in my mind.
Well,
I think
if you hadn't heard it yet, she hobnobs around with a lot of big wigs, important people.
like
And
all of
we're just
you.
like all of us.
She mentioned that we used to dance together. If they won't see her, she just tap dances all over their desks until she does. She's an excellent advocate to have on your side. That's for sure.
Yeah, she really is. Well, I lost everybody's picture there for a minute. Well,
Yeah.
Me too.
I'm gonna leapfrog over Michelle. We'll come back to Michelle after Judy because Judy has a bandage on the side of her face. We've all been wondering. We've all been wondering what's going on with Judy.
I had nose surgery today for what is it? This carcinoma, whatever.
Sarcoma.
Sarcoma. It's about they got it the first dig, which was good. But then it was about the size of a nickel, they said, and then they take two little triangles above and below to pull it together. So I just had that this morning done. So have to have the band.
Was that basal cell or melanoma or
No, it
sarcoma?
wasn't melanoma, thankfully. It was it's called whatever Michelle said to the I get them all mixed up.
It's all the syllables, right? And you already know so much about sarcoma.
Sarcoma. It was the sarcoma carcinoma. Yeah.
Well, and so it was a Mohs surgeon, so they for scarring, they make it nice, right? They do a nice.
They take this circular part out and then they put a triangle at the top and a triangle at the bottom so it can pull together and make a nice scar. I had one of those on my side of my face and you can't tell that I had it, but she did a great job. It's the same doctor did it.
So it's like you had a half a facelift today.
I don't know. She had me smile to see what crease to put it in.
Oh my God. But anyway. Judy, it probably hurts to do that.
So, but it's just the numbings about coming off. I will tell you one of the things I did though is that Dr. Awan, we had talked about last week. He had said, well, do you need numbing cream for your port? And I've never used numbing cream for my port, but I decided to ask him to prescribe it because when I had this side, and evidently there are more nerves in this part of your face than down here, because I about came out of the chair when they were numbing it up for this side of my face. So I decided to ask him for numbing cream that I put on it, and it helped when they started doing all the shots for the lidocaine stuff. So,
thank goodness.
And I saw Dr. Awan last week, and my numbers are still bouncing around. Platelets are back down to like 128. They go up and down. My IgG keeps going down, although it was 12 points above 600. So I expect next month, it'll be below the 600 threshold, which is when he gives me the IVIG. So, but other than that, I've done okay. I think last time I told you that my friend had the brain tumor and she did pass away a week ago Sunday. So she had glioblastoma and lasted 6 months from diagnosis. So was
sorry about that.
Pretty quick.
Very difficult brain cancer to deal with.
Oh yeah, very, very, very difficult.
So Nancy, you're right. I didn't have the right one. Squamous cell. Is that what it was?
Yeah.
Squamous cell, yeah.
Squamous. Thank you.
Yeah.
But anyway, had one there, and I've had a couple of others and a couple of myeloma. I mean, melanomas. So
I
you know.
just, I have the benefit of the doctor sitting
Oh yeah.
right here. So he can clue me in, and I sound like I know something. Judy, wasn't this a friend that went back to like high school with you?
Well, not in high school. I lived with her my senior year in college. She and her husband. My last semester of college, and so I've known her since 1968.
Wow,
So
that's an amazing history right there.
yeah, so
I'm so glad you had all the time you did at the last few months. You made such an effort to spend that together.
if it's like losing your sister more than, of course, I've
Yeah.
never had a sister. I only had sisters by friends, but so
She sure was.
Oh, so how are you doing? Are you swimming more because of that?
Well, of course I can't swim now, but she and I swam and walked together a lot, and the day before she was diagnosed and had the symptom things to come up, she had walked 2 miles. So she was very, very active, and just to go down that fast is something. So
Yeah,
anyway.
there's that thing again that we need to be doing things now, not putting them off, right?
Absolutely. Yep. So, but anyway, I think my deal with dermatology is be sure and go see your dermatologist. I see it every 3 months. So, I think
I missed my
the
6
3 months before, I think she's burned it off. And then this time decided well, she didn't know, it was just kind of a crusty, not healing. And then this time she said, I'm not positive it was the same place, but was in the same area, that she took a biopsy, and then one off the top of my head, and then burnt this part here. So I'm always, everything is so not by the book that they take a lot more biopsies probably from me than they do from other people.
Just to make sure, right?
Yeah.
CLL patients, the secondary cancer is skin cancer for us. Yes, so that's why and also obviously Judy has also probably
I've had
Are
one
you-
on my face, one on my back, one here, and then a year ago I had the one on my neck, the melanoma.
I forgot to make my appointment when I left the dermatologist last time, and now they can't see me forever in a day. So I was going every 6 months, which they suggest, but it won't be that.
Can they message the doctor and see if they can put you in? Because like when I went to make my 3-month deal, she said, well, they don't have anything until September. I said, but she sees me every 3 months. So, sometimes if you go back and say, she wants to see me every 6 months, maybe they can put you in.
I'll try.
I have a 99-year-old friend who had melanoma removed from the top of his head, and also a spot on his back, and it's all healing up nicely. The doctors say they feel like they got it all, and he's 99 years old. He missed work 2 weeks rather, or 3 weeks. He goes to the VA twice a week, Tuesdays and Thursdays. He goes to the VA where he volunteers, and his job is to take the blood samples from the lab and push them from the collection point to the lab for testing. And he's also legally blind. And
oh my goodness!
His name is Ellis Fish, and he's a ham operator. We talk to him, hear him every morning, and he just loves talking to his friends and giving us an update. And he just, you need people like that in your life that are day brighteners. And Ellis is one of our day brighteners. He used to get up every morning and walk his dog 2 miles, legally blind from just the deteriorating eyesight. And that dog would go out for a walk every morning. Didn't matter that it was dark, and come back, and we got to see him every year. He would host a group of about 30 people would come together and have hamburgers at his house in Albuquerque in August, and we're looking forward to doing that again this year. So that's my plug for a positive person in my life.
I now have a MRI. Well, I'm getting Pemgarda next week. I'm having an MRI later that is in my pancreatic study that I'm in. And then we'll have another CT scan in July or June, last of June, just to check. So,
Judy, what's Pemgarda for?
that's the Pemgarda is for COVID.
Oh, right. Are you on the study?
No, I've already had one the 1st of December, and they want you to have it about every 3 months or so, and this is the second dose of it. So I'll have the infusion on next Wednesday.
Did you get COVID this year or not, or did it protect you?
Never had COVID.
That's good. That's great. You're one of the few people, probably.
Well, with having the shots, and I'm just very, very careful, and have took what was the other shots that we had? Can't remember. Evusheld. I had those, and then I'm taking that. So,
yeah, I had done that too. Yeah, you can be as careful as you are. It all depends on how everybody else in your house is, though.
Yeah. Well, right now I have nobody in the house, so to do it. So.
Well, Michelle, we're back to you for your update. In a nutshell, my update was I saw Dr. Juan. All my counts are normal. My blood holiday treatment holiday continues. It's been 2 years off of a brood nib, so I'm just waiting for them to say, okay, you can go back on treatment. Then I'll have something more to report.
No,
That's it
I
for
like
now.
your report now. I think it should stay like that.
Yeah.
And that'd be wonderful. I had my appointment a couple of weeks ago, and I remain on acalabrutinib, otherwise known as Calquence, and my numbers were all good. We went over my my MRD test, which I can't remember if I shared with you all. I don't think I did. It came back. I haven't reached UMRD. It came back something like 0.74, and the time before that, it was 0.43. But they said basically it's the same. That it all depends on that close is basically the same. That it all depends on the sample of blood. That the next day it could have been a little lower, but I mean, obviously I'm not UMRD. I've never had clonoSEQ because I've never gotten low enough to test to see about that. So, sorry. Yes, I like country now. That was my phone ringing. I bet you're surprised to have somebody up in Massachusetts with country music on their phone. My husband, he got me into it. And I think I shared was it you, Nancy? I've even been to the Houston Rodeo, so that was a lot of fun.
You're just a Texas girl, you're just a Texas girl undercover in Massachusetts.
I was thinking of doing a story. I was going to go back in 2020, but it was the pandemic. I was going to go back and do a story on a Yankee visits the rodeo, or Yankee or something like that.
Yeah.
I had gone just for fun, but I thought of it when I was there.
You'd be perfect for it. You'd be perfect for it. Have you seen the commercial for I think it's a Airbnb, and it's like these Asian ladies, and they're all kind of doing a little bit of foot dance, and then they see this thing about going to Houston or going to Billy Bob's or, and the next thing you see is them all in Texas on vacation doing line dancing.
That's so cute.
It's a fun commercial.
I haven't seen that. Yeah, I even got my real hat at the rodeo. I have boots.
We're like that in Texas. We're just all about having a good time. And Gail, your sister is a connector. I just have to tell you, she connects people, and she just does it in the most natural, beautiful way. And she just moves so seamlessly socially that, she's just such a gift to our community and many other communities, but she connects people. And so, you'd have no trouble in Texas. We're a bunch of connectors down here.
Well, thank you. Thank you. Yeah, my favorite part of it was mutton busting for the little kids.
Yeah, they can earn some money doing that.
I didn't know that. Wow. So, but the other thing is, even though my appointment was very good, they told me about some trials that I would be a good candidate for. And one would have been to add on venetoclax. And at first they were saying, oh, but that'll allow you to go off treatment. And then they read it in more detail. Oh, we were mistaken. You'd have to stay on both indefinitely. I was like, yeah, no, thank you. And then another one is the new BCL2, in the latest BCL2 inhibitor and acalabrutinib. But I opted not to because I'm doing well. Normally I would probably say yes. So line dancing was invented by is that true, Lynn? By a line of girls outside the ladies' bathroom at Billy Bob's. Very good. That is good. That is a good one. So clinical trials are great, but in this particular case, thankfully, I don't need one. And yeah, if it had been to, I would have potentially considered if I'd get off treatment. So, but anyway, thank you all for being here. It's nice seeing you all, and I look forward to seeing you next month and hearing everyone's updates.
It's been a special time, y'all. And Nancy, you and Jay and Shirley and I will go out to eat sometime.
Yeah, yes, we want to do that. But also, I've decided too, Lynn, we need you to teach Jay and I how to use a ham radio. We've got some shortwave stuff, or we've got something out in the storage that we bought back at Y2K. And we need you to teach us how to use it in case we ever, have one of those blasts that takes all the stuff out.
Oh, okay.
Also, for those in Texas, and Michelle, you can come too. They're having LLS is having a in-person Texas 2025 meeting in Dallas, the first Saturday in May.
Oh, that's so soon.
Yeah,
Dr.
The nice
Dr.
thing
Jan from MD Anderson, JAIN.
Yeah.
Is that a national meeting or for Texas?
It says for Texas, but anybody could come. The nice thing they do at lunch, because they provide lunch, is they put the tables with the different blood cancers, and they put the sign on it so that you sit by table by what you have. And so we got to visit with people that had CLL and things last year when they had it. So.
Oh, that's wonderful. Tell them about our meetings.
Yeah, I've told it. In fact, I told somebody with CML, her husband had just been diagnosed with CML, and gave her the information and sent her the link. So I don't know whether they've just newly diagnosed. Hopefully they'll join it sometime.
Alexa, do you live near them in Texas?